When a patient calls for an ambulance and we have to take the patient from A to B, wherever that is, if a patient needs to go from A to B under emergency conditions using blue lights and sirens, for example, that generally can get the patient to will get the patients to hospital quicker than any other means on the roads. And the way we would kind of a good I suppose a good indicator of that would be an approximate value is we would normally get along the roads about 10% quicker from A to B than it would take the average road users. That's a very rough estimate. And the actual travel times compared to, say, Google Maps, which is a very reliable indicator of how long it takes to get from A to B, we can normally get about 10% quicker as a rule of thumb. So that's a very important thing for the public to understand. But what it does, going under blue lights and sirens, you're able to cut out the unnecessary or the avoidable delays. Obviously, if a road is closed, physically closed, there's no blue light in the world, it's going to make much difference to that. However, those are exceptional circumstances. But in the general run-of-mill and normal road usage, speed of getting from A to B is quicker using blue lights and sirens, safer for the patient to get there in the time. But we use those based on clinical needs, so the patients will be moved under blue lights when there is a need to do so. Our performance standards that we are now subject to as part of the National Performance Standards for all English ambulance services, related to strokes specifically, strokes come under our Category 2 standard, which means we've got to get to the patient on average within 18 minutes all the time. And also we've got to get to all patients 9 out of 10 times within 40 minutes. We have to do that's the national standards that we're expected to meet. So where strokes are categorised under the Category 2, that's the targets standards we have to get to. We've then got to get the patient from wherever they are into the ambulance and off to hospital. So we're trying to do that with the least amount of delay possible. So the window of opportunity for strokes in the community being assessed and treated by ambulance staff is a 2-hour window of opportunity from when the patient calls to when we get them to the hospital and into the hyper-acute stroke unit so they can start their treatment. And the treatment then, the phrase that is used in that is a 2-hour call to needle time. Call to needle, the phrase that people are hearing throughout this consultation quite frequently, refers to the point where someone makes a 999 call and we assess that patient or the patient they're being called on behalf of to be suffering with a stroke. That will then fall into a Category 2 response, 18 minutes average and 40 minutes 90% of the time. That's our performance standards we have to achieve. So the call to needle time is the time that we have to get to the patient and then get that patient to hospital. That's a 2-hour window. So that whole process, there's a 2-hour window to get them into the stroke unit to start their treatment. So effectively, the needle phrase refers to the start of the definitive treatment. So that's getting scanned and deciding what's wrong with you. Either you've got a stroke that's caused by a bleed in the brain, in which case there are options including surgery, or if it's a clot that's causing it, a blocked blood vessel, then clot busting drugs have to be administered, and that's the needle part that is referred to in the call to needle time. So the really crucial part of this is that we want to take the patient who's suffering a stroke to a HASU unit, hyper-acute stroke unit, first, straight away, directly to them without going anywhere else. That reduces the amount of delay there is, so you do not want your patients going into an A&E department and waiting for somebody else to then decide where to take them. We need to be making sure that we can go directly to the teams in the stroke unit so they immediately start their assessment. They can go into the scanner and get the diagnosis quickly. So that's really vitally important. Okay, I think the first point to start with is how important is it to have a HASU unit or the hyperacute stroke units configured where we don't currently have any. those, just introducing those will make a difference to the people in those more remote areas. Doesn't matter where you are is less important. More important is, can we get you to a hyper-acute stroke unit within the time frames? As far as the travel times of places like Margate, which sit on the outer edge of the options that are currently available, so your next nearest hospital would be the William Harvey. Actual travel time for patients from that area under a patient in an ambulance getting to the William Harvey, there are, we can do that in around about 50 minutes using blue lights. Getting a patient to the HASU unit is the most important bit. Subsequently, hopefully the patient will be able to be returned home earlier and quicker, with less disability following a stroke, or less chances of dying through a stroke. That's the important bit. So it requires, it is a difficult one for the outer reaches, the places like Margate. They are very challenged. It's a long way away from anywhere, but actually it's within the time frames that are acceptable within the parameters, the call to needle time that we talked about, the 2-hour window for ambulance services, and it is more important to go to a HASU. The ambulance service is not particularly wedded to any configuration. We will support what is safe for patients, and that's where we're coming back to. So we will expect, if to support this programme properly, that the ambulance service will have the appropriate resources given to us to allow us to ensure that there are the correct amount of ambulances to respond to patients in the light of the longer travel times. Delay can be caused by going to the wrong place. So you need to, the purpose of these changes is to take the patient the first time to the right place, where all the specialists for your particular condition are located, and your definitive treatment and diagnosis and treatment can start.